As a regional collaborative, we've identified several strategic priorities, and one of them is to meaningfully engage consumers in that transformation of health and healthcare.
We first decided to become involved in patient engagement work when we became part of a patient-centered medical home pilot in the state of Maine. And I have to admit, before we were involved in the pilot, I hadn't really thought about engaging patients in this way.
But this notion of inviting people in to look at our practice, to give us advice, I think it can be scary. It's understandable as a physician. I understand where that comes from.
Articulating a really clear framework of what you'd like to roll out is a huge component that helps success. When you don't have that, I think you have some mismatched priorities and agendas.
Use some of the resources that are out there as far as charters, things that help you organize a structure for your patient advisory council. I also think it really is important to be, thoughtful about who you might want to involve from your staff. I think that it, frequently makes sense to bring in folks that are sort of your frontline people, the people that are, greeting people at the window, answering phone calls, plus your clinical folks.
When we started this effort with a pilot, I don't think there was a single practice that had a real patient and family advisory council, and many of them really questioned why do we need to do this. So it was important, as with all aspects really of practice transformation, to give them some support and technical assistance with that. Luckily for us, we've been able to get that support in many ways. Certainly, as one of the 16 communities in the Aligning Forces for Quality initiative, we've been very linked into resources, information, tools about what does it mean to work with consumers, what does it mean to get people actively engaged in changing care. So that's been fantastic.